Camera, Mike, ready? All right. Good afternoon. Today I am joined by Secretary of Health John Weisman. We'd like to talk about our next steps in our statewide effort to defeat the COVID-19 virus. And we are very happy that we have a very effective, inexpensive, and essentially universally available tool that we can put to work to save lives in the state of Washington. And that is face coverings, masks. And today we want to announce the next step forward in using that tool in our great state. We know that face coverings are already required by law of employees and customers and visitors in the workplace, unless they're covered by a medical or other exemption. And in Yakima County today, businesses may not serve customers who are not compliant and adhering to that rule and are not wearing face coverings. Now we are taking the next step in our Mask Up, Open Up campaign. We know that we need to mask up so that we can fully open up our economy. And we're announcing a step in that direction today. In the next couple of days, I will be signing a proclamation will make this requirement uniform across the state of Washington. And what that means is beginning Tuesdays, businesses will not be allowed to legally serve customers goods or services unless their patrons are adhering to this requirement and are wearing face coverings. Now we're doing this for some very powerful reasons. First, we're doing this because of the extremely troublesome spike in the number of cases that we are experiencing across the state of Washington. And because we know that the better we can protect ourselves from the virus, the better we can avoid repeating the painful shutdowns that we've had to experience in the last several months. I'd like to go through with you some of the information that has led to this decision today. I'm going to share with you 3 graphs that show the troublesome progress of this virus in our state. Now we know that there are many states in our country today that are experiencing large growth of this virus. We are not alone in that regard. So I'd like to show you what the medical evidence is today in our state. First, I'd like to show you a graph that shows that our cases are increasing statewide. You'll note that these show the cases per 100,000 residents starting in March to the left of the graph and proceeding to the right of the graph. You'll see that the virus infection per day peaked in April, went down in April and May, started to go up in June, and now is basically at the same level it was at the peak infection rate that we were experiencing in April. And this is obviously a great cause for concern. We have today situations where our medical conditions are already stressed. People in Yakima are having to be transported by ambulance across the mountains because of lack of ICU beds. This is a present day problem in the state of Washington, both for the loss of loved ones and to have effective medical treatment. Second graph I'd like to show you that unfortunately this phenomenon is affecting essentially the whole state, or almost the whole state. This shows the new cases per 100,000 people in 6 of our counties. We'll see that in King, the cases went up dramatically, went down for a couple months, but now are going back up to 45.7 today. Spokane had a smaller peak beginning in the virus, but now has a higher peak and continuing to rise fairly significantly at 73.9. Whatcom County had a similar situation to King, a high peak in April, went down dramatically, and now it's back up to 64 cases and rising. Franklin County, again, had a relatively low peak in April, but now has gone up dramatically to 59.1. Yakima essentially escaped an early peak, but has been climbing significantly since mid-April, and now is at 617. I'll come back to Yakima in a moment. Pierce County, same story, high peak in April, significant reduction, and now it is rising again to 36.8. There's a couple lessons from these charts. One is that Washingtonians have done some good things. We knocked this virus down. We reduced the rate of infection, and that's because people did some very painful things in closing our economy. But now we'd like to continue to reopen our economy. That can only happen if we drive down this rate of infection that is increasing, and that involves wearing more masks. The third graph I'll show you is a graph produced by the Institute for Disease Modeling. This shows an epidemiological concept called the effective reproductive number, or R0, also known as RE. This shows the number of people that everyone who is infected infects. And you'll see beginning in March, in eastern Washington, which is the red line, and in western Washington, which is the purple line, the R0 number was somewhere between 2.5 and 3. That means every one person infected 2.5 to 3 people. Again, because of the good work we did in Washington, we knocked that number down. And we knocked it down so that it was below 1 in western Washington and at 1 in eastern Washington. That is absolutely critical, that number 1, because if we get that down below 1, the number of infections goes down over time. But if the number is above 1, the number of people who are infected goes up. Today, you'll notice in the recent few days, let's say since May 31st, the R0 number, unfortunately, has gone up significantly in western Washington. That now is up to about 1.5. In eastern Washington, worryingly, it's above 1, although it has, you'll notice, come down a little bit in the last couple of weeks. So the sum total of this information is that we have a very, very worrisome increasing infection rate in the state of Washington that is above 1. That means it is growing today essentially everywhere in all the regions of the state of Washington. Now, we also know this. These graphics show the virus has spiked in recent weeks, and we know this. This is not just a coincidence of more testing. It's because more people are becoming infected. That is clear. And John Weisman will talk about that a little bit more. This increasing virus transmission is seen in the number of new cases, in the percentage of positive test results, and the number of hospitalizations. Now, why is that R0 number going up? Why has it gone up above 1? And the answer is pretty simple. It is because people are interacting more. They're having more physical, close contacts. And it is important to know that it is today greater than 1, both in eastern and western Washington. It means the pandemic is growing, not slowing, in our state. And we know this. If we are going to interact with one another, we simply have to do it in a way that reduces the transmission of this disease. Now, here's the really, really good news, and I know these are distressing figures to us all, but there's some really good news here. Number one, we know that Washingtonians can be smart and knock down this disease. We've done it already in our original social distancing strategy. But it also means that we have a very, very low-cost, non-injurious, almost universally available tool at our disposal, and that's a mask, which we know works. And it doesn't cause too much of a hassle beyond just strapping it across our mouths and our nose. So it's really, in a sense, lucky that we have this available. It's not a high-tech solution. It doesn't require any technological innovation. It's just a piece of cloth, and it's available to all of us. And there is something very important about this measure that I'd like to just take a moment to talk about. It does provide, when we wear it, if I were to wear a mask, it would provide me some protection. but more importantly, it protects the other people around me. So that when I wear a mask and I go to the grocery store, I am protecting the grocery store clerk so that I don't infect the clerk. It means I don't infect a relative if I happen to be in the same room with my relative. And when we wear a mask, it is a signal of something about us. It's a signal that we care about the community. We care about our loved ones. We care about people we're doing business with. It is a symbol that we realize that we're willing to be a little bit heroic to protect other people. So even if a person doesn't really care about their own health, this masking requirement means we're all going to protect each other. And I think that's very Washingtonian. And the ability to save lives, the fact that it's available to all of us by doing this simple thing, I think that's in a sense a gift. We don't have to be a firefighter or a nurse to save lives. We can do it simply by wearing a mask. So we're taking these additional steps because we need more people to embrace this rule for it to be effective. And it is a reasonable expectation for businesses to enforce this law because it protects the people that they have some responsibility to, certainly their customers when they're shopping in their stores, and importantly, their own employees. You know, we have rules that, under our labor and industry rules, that employers owe their employees a safe place to work so their employees don't get sick on the job. This rule gives employees an added measure of protection. So if you're working for a company, you don't have to get exposed to people giving you the disease because they're not wearing a mask. So we believe in protecting employees in our state, and this is another measure that really will make sure that that happens. Now, for those who say this is not a problem, anyone who works in a hospital will tell you that this is not a moment of business as usual. Frontline workers have these concerns. I remember talking to a grocery store clerk in Tri-Cities telling me about that he feels that every day he goes to work, there's risk if people are not wearing masks. Now, here's another piece of good news, and that is that I really am happy that there is a growing bipartisan support for using this facial coverings tool. You know, this is important because we win wars when we are united. And we are now starting to have a unified position, frankly, of both parties in our state and to a large measure across the United States. Republican Vice President Mike Pence has now talked about the importance and utility of masks. I was joyful to see him coming off Air Force Two with a mask on the other day. And by the way, he's helped our state in a variety of ways working through this. Republican Senator Mitch McConnell has talked about, look, all this is putting on a mask. He kind of said it isn't that big a deal. A Republican Congressman Dan Newhouse, who represents the Yakima and Tri-Cities area, has been eloquent about the fact that masks can help. Texas Governor Greg Abbott, I think today, issued some rules about masking in Texas. Even the president yesterday said, I am all for masks. So this is a good sign that we are unified in this approach, and that doesn't mean that these folks have endorsed any of the policies that have been in place in the state of Washington. But what it does mean is that we realize that this is something that we all share, and that's the ability not to infect other people, Republicans and Democrats. Look, this virus does not discriminate between R's and D's. And I just think it's great that we're now becoming much more aligned in this regard. Now, today, I want to talk about several specific counties. Benton, Franklin, and Yakima counties are the only counties that remain in phase one. And we are joined today by Yakima Mayor Patricia Byers and Benton County Commissioner Jerome Delvin. We were going to have Franklin County Commissioner Brad Peck, but I guess he's having some technological difficulties. So they're going to talk about the importance of masks in their own communities in a few moments. And I also want to tell you, I've been very happy seeing the leadership in Central Washington rise up to the occasion. You know, they have local endeavors called Mask Up to Open Up. You know, meaning if we mask up, we can open up our economies. And it's working. Surveys show that more and more people in Central Washington are wearing face coverings. In less than a month, the percentage of Yakima folks who wear masks when they shop went up from 1/3 to just shy of 2/3, and that was a week or two ago, and I think it's improved since then. I talked to my good friend this morning from Sela, who told me that about 90% of people wearing masks going shopping the last few days in the Sela area. This is really impressive, both because it will save lives and because people are really getting involved in this team. Look, we know we can change, we can improve. This is a little change, but we know we can do that. We did it with seat belts, and we can certainly do it with face masks. But as more countries advance in phases, I've heard from local officials of these 3 counties that residents have simply been going to other counties for their services. And that's a concern because we don't want people spreading the virus from one county to another. So we need a containment strategy. And therefore, our Department of Health has been working with local officials to move these counties in sort of a modified phase 1. And this may seem a little counterintuitive, but it's a big part of our strategy because we think allowing a small amount of additional activity that occurs locally under stringent safety precautions, including making sure everybody's wearing a mask when they go to businesses, this is going to aid our efforts. It's going to reduce the number of infections that occur of people crossing county lines. And it's going to help, obviously, help some of these small businesses in these communities. So we are modifying the rules to affect that in this regard. But I want to stress during that period, masks will be mandatory, and I really appreciate the voices I heard. I went to Tri-Cities the other day and heard from 3 or 4 mayors that they suggested we do this. The chief of police of Kennewick suggested masks were very effective. The representatives of TriDec, the Tri-Cities Economic Development Arm, suggested that masks work. So we appreciate the leadership in Tri-Cities, and over half of the people in Tri-Cities are already doing this. But we need to boost that number up significantly if we're really going to get the protective impact to reduce this virus. I will add this too, there is some very preliminary evidence that is not conclusive that suggests that the efforts to mask up in Yakima County may have already reduced the rate of infection in Yakima County. Now, this is very preliminary, but it just adds to the mountain of evidence across the world that has shown that masks work. They save lives. So this should give us a cause for optimism. Beyond this, I'm also ordering a pause for 2 weeks on advancing counties from their current phase under the Safe Start plan. Like I said earlier, the rate of infection is increasing in all the regions. This is going to require additional containment steps, not just for Benton, Franklin, and Yakima counties. And it's based on the increase in the COVID-19 according to the Department of Health and the Institutes for Disease Modeling. Now, as we go along, we're going to learn what works and what gives us concern. And one of the concerns we have is about bars becoming a center of infection. We've seen this happen nationally. I'm sure you've heard the stories of dozens of people becoming infected at one bar at a time. So we are removing bar service from the list of permitted activities in those counties that are in phase 3. Bars are still permitted to be open and provide service under the reduced percentages, but they will not be allowed to serve patrons at the bar top, and the establishment must follow all of the restaurant and tavern health requirements. We're trying to eliminate the prolonged mingling in restaurants and taverns to ensure that people remain safe. And what this means is, look, if you're going to go into one of these establishments, we need to sit down, need to be served at our table. We just can't have folks mingling shoulder to shoulder. It's way too dangerous, and we want to learn the lesson of other states. And we know that other states, unfortunately, who have not done some of these things, have had to close their recently reopened restaurants, again, because of the disease transmission. We hope to avoid that fate. And I think the news here is today we're doing something that hopefully can avoid that fate, something that works, something we can all help on, something that is currently allowable and important to do. So with that, I'd like to turn it over to John Weisman to talk about the metrics behind some of the things we've talked about today. John.
Great, thanks, Governor Inslee. So as you said, COVID-19 continues to be a serious threat here in Washington state. The trends that we are seeing in our communities and across the state are very concerning and should make all of us stand to attention. In Washington, our case counts have dramatically increased over the past 5 to 6 weeks. Yesterday, we hit a near all-time high for the state with 618 new cases reported in a single day. And today, it looks like we're going to report over 700 cases today. While testing has increased significantly over the last month, and we're really pleased with that, we cannot solely attribute these increases to more testing. Other data show that a true increase in COVID-19 activity is occurring throughout the state. First, the proportion of positive tests is slowly increasing in Washington, suggesting that the disease activity is increasing as well. In early June, that was about 5.5% of the tests coming back positive and had dropped down to 4%. Now it's climbing back up to 5%, telling us that we are going in the wrong direction. Second, after analyzing the total tests performed, the total cases and deaths, our modeling estimates, as the governor said, show that our reproductive rate is greater than 1 in both Western and Eastern Washington. That means more than one person is getting infected for each new case, and that means the pandemic is growing right here in Washington. Third, the proportion of Washington people presenting to emergency departments with COVID-like illnesses is increasing. If it was just about us doing more testing, we really wouldn't expect to see this increase. And fourth, the number of COVID-19 patients admitted to the hospital has also increased over the past weeks from around 20 COVID patients a day in early June to 28 admissions per day in late June. Now, this is concerning because it takes about 2 weeks or so from the time someone is infected to the time that they may require hospitalization. And that means that these data are reflecting infections from 2 weeks ago. While overall we do have the capacity to care for COVID-19 patients in our hospitals today, although as the governor said, there are hospitals that are actually very stressed in the state, we can't wait until our hospitals are all full to act. That would be too late and really way too late. Given this information, the governor and I know that we need to take bold action so that we can further slow the spread of COVID-19. And that's why today we're putting a pause on all county applications to move to their next phase of the Safe Start plan. Counties will remain in their current phase for at least the next 2 weeks. Any applications that the department has under review will be paused until July 16th. And effective next week, as the governor said, new statewide proclamation will require businesses to refuse services to those not wearing face coverings and builds upon my statewide order, which requires individuals to wear face coverings in public settings. The science supports that when we use face coverings, we limit the spread of infected droplets being passed on to others when we talk, cough, or sneeze. And we know that somewhere between 20 and 40% of cases are asymptomatic, meaning that they don't show any symptoms, but people can still pass the virus on to others. We also know that people can spread the virus for up to 2 days before they begin showing any symptoms. And that is why face coverings just continue to be such a critical tool that we can use to slow the spread of this virus. We're also modifying the one activity that is allowed in phase 3 in terms of bar top service. Starting next week, it will not be permitted in Washington state. Individuals can still dine out following the guidance requirements. And counties that are currently in phase 3 will be required to follow these new guidelines. Finally, I'd like to talk about Benton, Franklin, and Yakima counties. These counties have been greatly impacted by COVID-19, and they do remain in phase 1 with only essential businesses open. The Department of Health has worked with these past 3 weeks with local health officials to develop a roadmap and containment strategy to help them progress forward in a safe and thoughtful way. Many residents from these hotspot counties are seeking services outside these counties, which carries the risk of spreading the virus into communities with less infection. We have seen improvements, as the governor said, in face cloth coverings in these communities. In Yakima, that went from 35% to 65% just within a month. And in Benton Franklin, it's now at about 54%. After the Board of Health in these communities and county commissioners take action, these counties will be allowed to move to a modified phase 1, which will allow construction, manufacturing, limited outdoor dining, in-store retail at 15% capacity, and dog grooming and gatherings of people less than 5. Keeping folks local for their services is an important element to containing the spread. And having businesses operate under the safe practices rather than people seeking services outside of safe business operations increases the safety. I'm counting on these communities to strictly enforce the safe business guidelines. Anything less than that will risk any progress. And I'm confident they will do so. Their chambers of commerce and other business groups have been hard at work helping businesses understand and comply with the business guidelines. This effort has been essential in our considerations of this action today. We will continue to work with these communities to monitor the trends of COVID-19 in the coming days and weeks, and we'll adjust our efforts as necessary. As a state, we have a challenging road ahead of us with this virus. If we want to keep businesses open and let our kids return to school in the fall, we need to do our part. All of us need to do our part to slow the transmission. As we head into this holiday weekend, I'd like to reiterate some critical steps that we must take every day. First, it is still safest to stay home, stay local, keep your circle of friends and close contacts small, practice good hygiene, and wear a cloth face covering in any public indoor setting or outdoors if you can't keep at least 6 feet of distance. This is not the time for extended family, friends, or neighborhood birthday parties, retirements, or 4th of July barbecues. It's a time to keep enjoying your immediate household and a very small, close circle of friends if you must. Together, we'll get through this. We can all do our part to protect our community, our friends, and our family. It's absolutely the respectful and responsible thing to do. I stand with Governor Inslee in encouraging all of us to wear our cloth face coverings as one of those critical tools in our toolkit to keep us moving forward. Thanks again for the governor for your leadership, and back to you.
Thanks, John. I'd now like to introduce Byers of Yakima. Before I do, I want to compliment the leaders in Yakima who have been leading a mask up campaign. They've handed out thousands of masks. Commissioner Baker, the county has been working on this. The mayor of Sela, Sherry Raymond, I met with, who said she's in favor of people wearing masks. So Mayor Byers, I'm looking forward to your description of your efforts.
Thank you, Governor. Can you hear me?
Yes, we can.
Wonderful. So first of all, I just want to thank you for this opportunity today. And I do want to give a huge thanks to all of the collaborative work in our community. I want to tell you all of the agencies that are working together. And this all started when about 4 or 5 weeks ago, you asked me to put a measure through our city council to recommend masking in public places where we could not social distance. And I did that, and the council passed the resolution, adopted the resolution, and so we enacted it then. And it broke out into a huge campaign community-wide called Mask Up to Open Up. So I want to thank, first of all, the city of Yakima, the residents of Yakima, Yakima County, the Yakima Health District, the Greater Yakima Chamber of Commerce, the Hispanic Chamber of Commerce, the Office of Emergency Management, the Yakima County Development Association, the Downtown Rotary Association, and the Yakima Valley Mall. We're just some of the major players, but it's really been an effort by the entire city to accomplish this, and actually we moved from 35% to 65%, which was an 85% increase in just a little over 2 weeks. So it's been a huge effort and a positive response. We're happy about that. And I also want to give a special thank you to my partner in all of this, Yakima County Commissioner Vicki Baker, who's sitting with me today, because we worked as a team diligently in this effort to help our local businesses open up, and I'm just very grateful.
Well, thank you, Mayor Byers. We're glad we're making progress. And we're gonna keep that up, I know. And I know businesses in Yakima are gonna help. So thank you very much. We have Commissioner Delvin. Commissioner, could you share your views and experience? And I appreciate talking to you the other day.
Yes, Governor, and I want to thank you and the Secretary Weissman for coming to the Tri-Cities this past Tuesday to listen to the community leaders, our health district, our healthcare professionals, and also our business community to hear what has been going on in our county for the last 3 months, really. I thank you for taking the time and listening to our stories and what we've been doing and going through. Secretary Weissman stated, 3 weeks ago, we started working with him and Dr. Lofi to try to come to some kind of a roadmap to recovery. And they've helped us develop that roadmap to recovery. And you've heard about it, what we're willing to do and what we have been doing, because we've been, the cities and the county leadership, along with the health district, as you said, the chambers and other business groups have been stepping up already with our wear a mask, open up. And so we're continuing to do that. We're going to follow that roadmap to recovery. In fact, today we're going to have a special health board meeting to adopt that roadmap. And then also Benton and Franklin counties are going to hold a special commissioner board meetings to adopt those also. And just a little side note here that we want to we talked about increasing our surveying to a weekly basis. The cities and the county volunteers went out with the health district protocols and actually did 2 days of surveying, and they came back with over 90% masking now in the businesses that they did survey. And I was just on the way home from the office, and I stopped at my Circle K to get my daily Coke Zero, and in there was 20 people. Only one person didn't have a mask on, and I think she felt a little shyness because everyone else had masks on and she didn't. She rushed right out of there. So I think our community is willing and ready, and this modified phase 1.5 I think gives us all hope now that we can start to move forward. And I know the business community is going to step up, and as our citizens are going to step up too. And so we just thank you for taking the time to come over here and listen to our stories, Governor.
Thanks for your leadership, Commissioner. You can't see me, but I'm smiling underneath this mask to hear that people really signing on to this in the Tri-Cities. It really gives us hope. And I also want to reiterate, when Tri-Cities does this, it helps people on the west side too, because look, this virus can spread. So wherever you are in the state of Washington, you're helping everybody in the state of Washington. So thanks for your leadership. I also wanted to give a shout out to Mayor Saul Martinez of Pasco, Mayor Ryan Luxon of Richland, Commissioner Brad Peck of Franklin County that I had good discussions with, and they were supportive of an effort to encourage people to wear masks. And so I appreciate their leadership as well. That's really good news. So we're going to keep up this effort. Before I take questions, I'd like to note something I just noticed the other day. It was brought to my attention by the Attorney General's office. There have been more than 15 lawsuits trying to block part or all of our stay-home order in state and federal courts across the state of Washington the last several months. There have been 10 motions for injunctive relief have been filed. That's where someone asked the judge to stop our rules. Not one has been granted. Several lawsuits have been given up or abandoned. Court rulings, judges have described some of these lawsuits as frivolous, unpersuasive, and completely devoid of merit. Now, there's a reason for this. It's because we are lawfully using our emergency statutory authority to protect people's lives. And that's the job of elected folks right now. And the way we're doing this respects the United States Constitution, and it respects the Washington State Constitution, and it respects the oath that all of us have taken in public office, including the officials you just heard speak. And that's because there is nowhere in the United States Constitution that says that anyone has a right to infect another person with a deadly disease. So I'm pleased that we are continuing to work together on this, exercising common sense and the United States Constitution. I'd like to tell people when this emergency will be over, but emergencies by nature follow their own rules, not ours. And until there's widely available treatments to suppress the spread and effects, this fight is going to continue. But we're stronger today than we were yesterday because we're taking more steps. And you heard Commissioner Delvin talk about the progress we're already making in the Tri-Cities because of the community effort. One closing comment, and that is about our celebration of Independence Day. This is a moment, obviously, of the great blessings of democracy, and I know we're going to enjoy that in our own way. But this year, I really hope people want to celebrate trying to win independence from this virus, as well as independent for our nation. And that means it's got to be a little bit different than we usually do it. If we're doing things we normally do in the same way, that's a little bit too dangerous this year. So I hope people are going to enjoy people, but have good social distancing, do it outside of humanly possible. Wear a mask, this makes sense, maybe with a flag on it, or maybe your favorite team, or whatever is your taste. I will make a couple other comments of clarity I wanted to mention. The state is working with cities and counties on this effort. The state has delivered or will deliver 3.6 million masks to low-income people to make sure that they were available. And cities and counties and nonprofits are also doing the same thing. A couple other comments about our proclamation that I announced today. Number one, this is not an optional plan for businesses. This is a legal requirement. This is not merely a suggestion. If you go to a business and you're not complying with this, the business cannot legally serve you, and that's not an option for them. It is simply required by our law. The second thing I will say is if you do have a medical condition that makes wearing a mask difficult for you, you do not have to tell the business what that medical condition is. You simply tell the business owner, I have a medical condition that exempts me, and that will be honored by the business. So we think we have a plan that can save people's lives, that is inexpensive, achievable, and I'm looking forward to our continued success along the nature we've already had. With that, happy to stand for questions.
This is for either the governor or Secretary Weissman. In regards to the 2-week pause for counties, is that an indication that there's a belief that some counties were advanced too quickly into phase 3? And has the state given itself enough time to evaluate the data from previous reopenings?
John, do you want to start? I may follow up, but.
Sure. I think what this really is a reflection of is the increased activity, and that, as the governor said, the social interactions are increasing the virus spread. And in part that's because we're not being as careful as we need to be. As the governor said, if we keep our physical distancing, if we implement the safe business practices as described, and if we're wearing our face coverings, we're gonna prevent that increase in infections. What this really does is it gives us a chance to pause, take a look at what's happening, make sure we fully understand where the numbers are going, which we know right now are not in the direction we want them to go. And it gives time for these face covering mandates to take hold. We know that using face coverings, when other states have done this mandatorily, that actually within 5 days, many states start seeing a slow in their spread. And I think that's the hope that we have from Yakima County. As the governor said, while the data are preliminary there, we have seen their rate of infections go down from 700 per 100,000 people in 14 days down to 600. And they have been increasing their face covering usage during this time. So we're really hopeful. This is a time to pause, make sure we understand our numbers, and then consider how to best move forward.
Yeah, and if I can add, the kind of moment we're in, I used to paint houses working my way through college, and sometimes you'd have to step on one ladder over to another ladder. And you paused when you make that transition. And that's kind of what we're doing, because we're making a transition from social distancing, shutting down businesses, to universal use of masks and social distancing. And we got to make sure we make that transition right and carefully, and that's what we're doing. And the good news is, we think we're going to be going up as we continue to increase the percentages as they go up of people who wear masks. I think that's the challenge of the moment.
Yes, and concerning the statewide business requirement with masks, does that now cover working out in gyms, a specific modification that California announced yesterday?
Well, that is a very interesting question. John, do we have absolute clarity on that regard? I'm not sure we have a specific rule on gyms in that regard.
First of all, gyms aren't allowed to be open until phase 3, and they're at 50% capacity at that point in time when that happens, again, purposely to increase the physical distance. We do require face coverings if you can't keep that physical distance during that time.
Okay. Next question comes from Essex with Cairo.
Governor, two questions for you. Did you end up, as you look back on it, did you end up yielding to pressure to reopen too soon? And second question, we're understanding that there will not be a special session, but how can we wait until January to deal with such a huge budget gap?
Well, you know, I've said this before. I use drive in the rear view mirror. So spending a lot of our limited time thinking about the past is not something that's really productive. But I will tell you, I think the decisions we have made have been appropriate and based on science. And I can't think of any right now that I really regret. And we have had success bending the curve as much or probably more than any other state in the country, at least as much. So our decisions in this pandemic have been successful and as or more successful than other locations. So I can't express any great regret. So no, I did not yield to pressure. The only pressure I feel is science, and you got to follow the science. And what the science have led us to believe that we've had considerable success to date, but people seem to be lessening their commitment now to some of the social distancing requirements. And we haven't got the use of masks up as high as we believe we need. And that now we need to buckle down and do those things. And I have a confidence that these are actually going to work if Washingtonians do this. So I think, and again, I've said this many times, I'll say it again, I want to credit Washingtonians for what they've done. They bent the curve down. They did buckle down. They did follow our Safe Start rules. And if they continue to do that, given the current status, I think there's a reason to believe that we're going to continue to not allow this to overrun the state of Washington and our hospitals. So I come to you with good news today, which is we have a mechanism for using our heads and our science and our common sense to rescue lives in the state of Washington. Now that's good news. And today we are recruiting more people to do it, and that's the businesses who will now are being recruited. Maybe that's a draft, but it's a good one, and it's a necessary one. And I think it's going to have good success. That's what I believe. On the session, the reason there isn't a necessity of a special session is right now we do have adequate resources for the state to fulfill its obligations, up to January. We have a healthy reserve. We have made cuts already of about approaching $600 million. So we have already tightened our belts and are in a position to be able to last until January.
Would you like to ask a follow-up?
No, thank you.
Great. Governor and Secretary Weissman, are there specific reasons identified for the increase in cases across the state or in parts of the state?
John, would you like to address that?
Well, I think as the governor indicated, the reason we have increases is that people are increasing their interactions and are not sort of paying attention to the physical distancing that we are talking about to the level that they need to. I also believe that people are expanding their circle of folks that they're having close contact with to a larger extent than what we're recommending. We're really encouraging you to keep a very small circle of people who you're engaging with throughout the week. These things with the face coverings, folks pay attention to these, are going to lead to our success. And again, we're already seeing that happen in these counties that we've just been talking about, and they're coming together around this. I think it's, challenging. I understand people are tired. They are interested in engaging with others. They did a great job in the beginning, but we're in this for the long haul. These viruses, have a timeline of their own. They're not necessarily our timeline, and we have to remain vigilant. We can do this. It's important that we do this together. And as we do that, and I think as we adopt these additional measures, we're gonna continue to see success.
Next question comes from Jerry with the other side.
I'm sorry, I didn't. Governor, I want to ask you about the issue of compliance and enforcement with this new statewide order regarding for businesses. What is the plan for the state to intercede and, if you will, crack down on those that are not compliant?
Well, the plan is to continue to enjoy the really pleasant success we have had already with our stay home, stay healthy order. We had massive compliance to date with this. The vast majority of Washingtonians and Washington businesses have adhered to this. And as a result of that, we bent this curve dramatically, as I've said, as perhaps as successfully as any other state. And that happened because a combination of people understanding the common sense scientific reason for that and the fact that it was the law, and those two things work. People want to comply with the law voluntarily. So our plan is to continue that type of approach on this business requirement. Now, just as the previous order, there are sanctions if businesses do not comply. Fines, potential closure, L&I violation sanctions. But we don't want to use those systems and should not have to. And if we simply continue the current practice of adhering to the law, a massive number of businesses are going to adhere, and we're going to have a great success here. And I believe that's going to happen. I've talked to a lot of business people. They've been successful. Costco and many businesses already have this. We saw Jerome Delvin just told us that 90% of people are doing this in Tri-Cities. I talked to a friend in Selah this morning who indicated 90% are already doing this in Selah, Washington, where the mayor herself is in favor of masks. So I'm actually have a reason for confidence this is going to happen without having to invoke any particular enforcement action.
Jerry, would you like to ask a follow-up?
Well, I guess so. I mean, I think there is a concern out there by those businesses that are being compliant that 10% of the non-compliant are a critical cause or factor in these cases going up. And they're sitting there wondering, are we going to go out of business or have to shut down because the business down the street is breaking the rules that the state set and isn't enforcing? So I'm wondering can you suspend aspects of due process that the L&I and Department of Licensing follow to intercede quickly when you get these complaints about businesses of people mingling at bars and so forth, and do something so other businesses that are following the rules don't have to fear about going out of business?
Well, I do not going to happen. As I've indicated, it has not happened. The state has pulled together. I believe it will continue to pull together. If there's some situation that where folks do not comply, as I've said, enforcement action is possible. There have been a number of enforcement action against businesses. Almost all of them have been successful in short order, but we should not have to go that route. And I don't believe we're going to have to. And we haven't had to do that. And yet we've had considerable success in bending this curve. Now we have to do what smart states do. As things change, as we learn, as the virus rebounds, we can't just sit on our hands and let us overwhelm us. So we're taking action. That's what we do in Washington State. We just don't let something roll over the top of us. And I believe we're going to be successful in this business rule and have been already to some degree.
We just received a follow-up from Joe with the Seattle Times. Governor, you sound pretty definitive, but no special session is necessary. Do you foresee any reason for lawmakers to return before January?
I would not rule out some reason for a special session. I can't predict the future. I can't say definitively that there isn't. I would say at the moment, the question was, how could we get to January? And the answer is because we have enough resources to do that, in part because I've already done belt tightening. Now, we are hopeful that Congress is going to give us an infusion of help if the Senate will not follow Mitch McConnell, who said he, kind of wanted to let the states just go bankrupt if necessary, and we hope that Congress will come through. That will be an added degree of assistance. We hope. It's not a certainty. So I would not rule it out, but at the moment I can tell you that we do have the financial capability to go further.
This question comes from Laurel with the Spokes interview.
Hi, Governor. 2 questions. What is the state doing to increase the amount of testing supplies and materials to counties who might need them and are experiencing shortages? And second question, are you considering any sort of masking survey requirements in Spokane County or other counties as these new rules are going into effect?
So in testing, we continue to work to have a more effective testing regime. One of the things we're doing is we've asked the federal government to be more effective in their provision of testing kits. Secretary Weissman wrote a letter to the federal government a few days ago identifying some of the problems with getting defective and incomplete and unorganized kits that have made it very difficult for us to do this. We hope the federal government will improve their performance in that regard so that we can increase the availability of testing on a more effective basis. Now we're doing some other things, if I can just add too, we're doing things to allow testing to work, meaning that people who are positive actually do contact tracing and then they effectively isolate. And one of the things we're doing is trying to improve the support systems to families who have to isolate in a variety of ways. I saw Spokane County has 300 people in a voluntary organization to help these families to isolate. Very creative. They even they give pulse oximeters to put on your fingers. So if your oxygenation level gets low, to go to the hospital. That's the kind of thing we need to build across the state of Washington. We're working on that with a variety of counties. We're also considering a way to enable and encourage businesses as appropriate to make sure that they follow a local health directive. If the local health director orders a business to do broad scale testing, we have to make sure that they do that. So that's one of the things we're trying to assure as well. You ask a mask question. I'm trying to remember, I'm trying to read my writing here. The mask survey, yes. We are requiring a survey in some counties. John, I can't recall exactly what counties where we're requiring this.
Right now it's Benton, Franklin, and Yakima. And I think as we continue to go forward, we'll keep examining if that's important as county situations change. We also know that there are some efforts underway for grocery store chains in working with other researchers to look at what mask usage is. So we're going to keep engaged in those because we want to know, just like everyone else, that we're making the progress that we're looking for.
Would you like to ask a follow-up?
No, I'm okay. Thank you.
Great. Next question.
If I can just add something to this. I think it is important to realize this is an iterative process. As we monitor situations, we adapt. It's one of the reasons we've had some success. So Spokane County, they are having a relatively rapid rise. If that continues to move forward and we have questions about mask usage, you can anticipate we would have a surveying requirement in Spokane as well. So, you know, these things can alter as time goes on. And we hope Spokane is successful in their mask up effort. I know that they have a lot of local leadership that is doing that in Spokane, and we appreciate that.
Next question comes from Tom with Northwest News Network.
Hi, just a couple quick questions for Secretary Weissman to clarify the 2-week pause. Does this apply retroactively to counties that seem to have the virus under control, like San Juan, Klickitat, Jefferson, that have applied to move from phase 2 to phase 3 before today's announcement and have their variance application pending on your desk?
Yes, the pause is applying to all applications that we currently have. We have reviewed some applications and put them on pause even before this, given the situation in their counties. So we're taking this time to stop and evaluate all across the state.
Decisions are hard. If it's a saving grace at all, many, many states are in this situation right now. I got a call from a governor a couple hours ago in similar situations. We know Texas, California, other places, this virus has some common trend, which is it can come back. And we've got to be aggressive.
Please, on the phase 1.5 for Yakima and Benton and Franklin, would they all move together to 1.5 or what's your thinking? So I assume the two-week pause doesn't apply to the advancement for those counties.
That's correct. And so the process moving forward with Yakima and Benton and Franklin, and you actually heard one commissioner already indicate this, their boards of health need to look at their roadmap to recovery. I know their health directors have been already talking with those elected officials about those roadmaps and been getting their input into that. So the Board of Health will need to approve that, and the county commissioners approve that. And given that we've been working closely with them, we know what is in those roadmaps. And as soon as we receive those with the elected officials indicating when they want to move forward with the 1.5 or the modified phase 1 application, I'll be prepared to approve that in very quick order. Again, lots of work has been happening with these communities for 3 weeks around this, and we're really pleased with the engagement that we've had.
If I can add something else too, this involvement is not just this rule. We're helping local communities with communication to increase increase usage of masks. We will be having a multi-million-dollar communications effort to share this information with Washingtonians. And that's going to align with a lot of the local efforts that are going on right now. And the Yakima, as I said, has a mask up campaign. Tri-Cities are doing some good things. Spokane has a local effort. So we're going to marry our state campaign, if you will, with some of these local efforts that I hope be successful. And it'll be important too, because it's going to be multilingual. A lot of people, as we know, the Hispanic community has been hit doubly hard. Their rate of infection has been much higher than their per capita rates. And we want to make sure that they have the right information to allow them to protect themselves as well.
Next question comes from Alexis with the News Tribune.
Governor, what difficulty, if any, has there been getting businesses to cooperate with local health departments in terms of investigations and contact tracing?
I think John probably has a better description than myself on that. John?
Right, sure. Thanks for that. Now, I'll start out by saying most businesses are happy to engage their local public health department in getting technical assistance when they have a case and investigations. There have been some times when some businesses aren't returning the calls of the local health officials or aren't granting sort of immediate access to facilities and workers to be able to do their investigations. And I think that's getting better as people understand what it is we're doing and just how serious this pandemic is. So this was in response to some local health officials sharing those concerns and indicating that it would be helpful if the state would be really clear about the need to comply with public health agencies, whether that's the local agency or the state. And again, most are doing so, and we're appreciative of that. This just gives it the clarity about needing to respond quickly and to implement the recommendations of the local health department.
If I can just give you of optimism, we were really favored by an enlightened business community in our state of Washington in a whole host of ways. They started to allow people to telecommute even before there were orders because they recognized the danger of COVID. I talked to dozens of business leaders who've just done everything they could to keep people on their payroll. We think we're going to have broad support for this effort because businesses know this is the best way to reopen so that all businesses can reopen. We mask up so we can open up, and business leaders understand that. They want to get business in, and this is the fastest ticket to an open economy. So they care about their employees, they care about their customers, and they know it's the best way to open up. So we're actually confident about the direction we're going here.
Alexis, would you like to ask a follow-up?
No, thank you.
Next question comes from Justin with KNDU.
Hello, Governor. What's the timeline on when these counties will move into 1.5? And we received during the Ben Franklin Health District's press conference this morning, and they said they reached out to you about certain freedom protests that are happening in these counties that are going to attract large gatherings. And they said that they were looking for your assistance in those matters. What's your plan for those things?
Well, the plan is to do what we're doing, which is to urge Washingtonians to protect themselves and protect the people around them, including their family members, and also follow the law. And basically that means maintain social distancing and wear a mask. And it's all not all that complicated. Now, the fact of the matter is that in any group of 7 million people, you might find folks who get the memo later than everybody else. But this is just not a cause for debate about this. And by the way, the reason I think that we are being so successful as we are in Benton County, you just heard Commissioner Delvin, Republican, who talked about the fact that more people are wearing masks, the vast majority of people. And that's happening in the Tri-Cities. And so we shouldn't be dissuaded because there's a couple folks that, haven't quite read the scientific literature. And as far as the Constitution, look, every single person that's challenged this on a Constitution has not been upheld, at least at the moment, by the court system. And we have the court system that protects our constitutional rights. That's how we answer these questions. So for folks that are arguing that somehow in the U.S. Constitution it says that we all have a right to give a deadly disease to somebody else, I've read it, it's just not there. So we are hopeful that people protect themselves and people around them, including on July 4th, anywhere they go, and we hope that'll be the case.
Justin, would you like to ask a follow-up?
No, thank you.
Okay, great. Final.
Oh, there was a question about the time. Go into effect. John, when will this go into effect, Tri-Cities?
Yeah, so the timeline again, we were really clear. We wanted local officials to determine the timeline. I think you heard Benton Franklin Health District sounds like they're having a meeting right now to review their roadmap, and I'm assuming approve that, followed by their commissioners meeting to approve that as well. So I'm anticipating probably receiving that as early as this evening. And I suspect that Yakima isn't too far behind. But again, we wanted those elected officials to really drive the timeline. and so that we can open up responsibly, safely. Again, I know they've been working with their businesses and their chambers, really anticipating this day coming.
Final question comes from Carolyn with the South Seattle Emerald.
Hi, yes. So I've read a few reports about and seen at least one picture proving that some grocery stores, like several Seattle-based Safeways, at least one in West Seattle and Fred Meyer in North Seattle, are not enforcing mask use among their employees or patrons and are not enforcing social distancing requirements. At least one of these businesses has been reported more than once, but has apparently not changed practices. Why hasn't the state been more active in ensuring that corporations and companies that are deemed essential businesses are putting their employees' and customers' health and safety first, particularly since coronavirus cases in King County have more than doubled in the last 2 weeks? And at least 40% of those are coming from the city of Seattle. And then additionally, as the Herald reporter asked, how are you going to keep a handle on this going forward, since presumably the previous mask mandate you issued made it mandatory to wear masks inside these businesses before?
Well, these businesses, thank you for your information. We appreciate that. You can anticipate these businesses getting a call, and I'll bet you $1 to a donut we're going to get better compliance if that's the effect. And that's what we have found in our safe, stay home, stay healthy initiative. As I said, vast majority of the businesses complied. For those few that did not, they'd get a call, and within 24 hours usually came into compliance. And for the even smaller percentage that were kind of acting in an objectionable way, they could get sanctioned, and then they would comply. So thank you for the intelligence. We'll act accordingly.
Any final words, Governor?
Again, I want to thank everyone for their efforts. We hope everyone will be a Washingtonian. We hope everyone will be a hero. We hope everyone will take care of their families. And that means I hope everybody's going to mask up. Thank you very much. Have a happy 4th.